Hey guys, this is Dr. Ryan DeBell from the Movement Fix, and I have a very special guest with me today, Dr. Allison Porter, a general surgeon, 2011 CrossFit Games competitor, and former Miss Washington. And we're going to talk about the idea of rolling out the psoas, jamming in there, putting pressure, trying to release the psoas, and get her perspective on, is it a good idea? Are there structures in the abdomen that might be something we need to worry about or be concerned about, and get her recommendations. So thank you for spending your time and giving us a minute of your time. First of all, let's talk about the difference between rolling out like your arm or your leg versus rolling out into the abdomen. Can you kind of talk about the anatomical differences there?
Sure. I mean, when you're rolling out a leg or an extremity, you have muscles on the outside of that, and so that's most likely what's going to get the pressure from the rolling out. But if you are trying to roll out something in the abdomen, there are a whole slew of abdominal organs that are also there. So I think it's harder to reach if you're going for the psoas, it's going to be a lot harder to reach it because there's a lot of stuff in the way.
Gotcha. So in the leg, you have the skin and then the muscles, basically.
And fat.
A little bit of connective tissue, but there's not a lot between the muscles and
for most of the extremity.
Yeah, for most of the extremity.
Right.
But for the abdomen, there's a lot of stuff.
True.
And can you kind of take us through, if you cut me open, what would you have to go through to get to my psoas?
Sure. So, the abdominal wall has skin, fat, muscle, and there's fascia overlying the muscle. And then beyond that, there's a thin layer called peritoneum. Within that, there's a kind of like a fatty flap called the omentum. You have your small intestine, and then you have your large intestine. If you wanted to get to the psoas, off to the side, there's the colon is kind of stuck to the back of the abdominal wall. There's no way to release it unless you're actually cutting the tissue that attaches it to the back of the abdominal wall. So you basically would have to press on the colon in order to press on the psoas.
Gotcha. So the things that could move around, like say someone was pressing in here.
Right.
What could move out of the way?
Your small bowel probably could move, and your omentum could probably move out of the way.
But the colon, the large intestines they can't really move because they're stuck.
No. So the colon is stuck to the back. It's called retroperitoneal. And there's another of other structures back there. Your kidneys are retroperitoneal, so they can't move. The ureters, which carry urine from the kidneys to the bladder, are also retroperitoneal. They're right in front of the psoas. They don't move. There's a nerve called the genitofemoral nerve that lies right on top of the psoas. It supplies sensory to the scrotum or labia in men or women, and also to the thigh, and then is also responsible for the cremasteric reflex, which is what causes the testicle to rise. That nerve is right on top of the psoas. So all of those structures, the aorta and its bifurcation, and also the inferior vena cava are all retroperitoneal structures that are very close to the psoas.
And so those won't slide out of the way necessarily.
That's right.
Okay. So those are things to be a little bit concerned about if you're going to take something and aggressively jam it into your abdomen.
True.
Right? Like they're not just going to slide out of the way.
That's right.
And you told me earlier that you did you were in surgery earlier today, and it took you 30 minutes to get down to the psoas.
Yes, we were trying to expose actually the area of the spine that is right behind where the aorta and the inferior vena cava have their bifurcation where they split to go to the legs. And to get there, you kind of have to get to the psoas first so you can get around. And it took us like a half an hour to get to where we were actually seeing, touching, and feeling the psoas.
So half hour in surgery, 3 seconds, maybe a little bit different.
There's a lot of stuff in the way.
There's a lot of stuff. So you said earlier that some of the structures won't move. Are there any structures that are at risk of being damaged by having prolonged pressure or really deep pressure applied to it?
Operating in the abdomen, I'm always worried about the bowel because we're taught to treat the bowel with ultimate respect. So we're very delicate with it. So I guess the idea of pushing something very hard into a place where the bowel lies doesn't really fit with my training. And then also with regards to vessels, it's possible to cause, whenever there's trauma to a blood vessel, you put it at risk for thrombosis, which is clotting. So, I don't know how how high the risk would be and how
Right.
hard you'd have to press and where exactly you'd have to press, but that would be something that I'd worry about if you're pressing anywhere near a large blood vessel.
Yeah, because the question would be, how hard do you have to press to get a clot? And,
Right.
and probably pretty, I don't know that everyone out there rolling out their psoas is getting clots forming. So maybe it's hard to know. We don't know that answer.
True.
Now, you mentioned before as well that some females may be at risk if they have a certain underlying condition, fibrosis.
I wasn't sure. I mean, it's possible that you could have, enlargement of the ovaries or uterus, depending on the age of someone, that kind of thing, and depending on exactly where you're pressing, how low, or how enlarged their organs might be. So that would be potentially another concern.
Yeah, another consideration if you're going to start pushing in here really aggressively.
Or it could be another cause of pain that might be the reason the person wants to target their psoas.
So someone could have pain in their abdomen, maybe even in their low back, that isn't coming from the psoas and may be misidentified.
That's true. There's so many things there that there's innumerable other causes of pain that could present in a place that felt a whole lot like the psoas but wasn't actually the psoas.
Gotcha. Okay. Now, do you think it's possible for me with my hand or with a tennis ball to get to my own psoas?
I think it's highly unlikely just because there's so much in the way, and it's a very medial structure, meaning it's very close to the middle of the back of your abdomen. If it was kind of off to the side, maybe you could, if you pressed really hard, you could get to it. But again, not only is it the colon, but the colon is full of stool. So that's a big soft thing that's going to be in the way. And then there's just a lot of other structures there too. So I think it's unlikely that you could get to the psoas with any ease unless you're an extremely thin person.
Got it. And you said in your training you were taught to respect the colon with the utmost.
Right.
How do you, when you are in surgery, how careful are you with the small intestines and the colon?
Yeah. An analogy I was thinking of is if you had like a 2-year-old little daughter who got her hair all tangled up and you had to get every little tangle out without hurting her. That's the type of delicacy that we're taught to use when we handle the intestine. So that's why the idea of pushing on it really hard is a little bit alarming to me.
Because in the operating room where you're cutting into somebody, you handle it with the utmost respect.
That's true.
And we potentially just jam on it more aggressively than you would in surgery.
That's right.
That concerns me a little bit.
Sure.
Yeah. One thing in some instructional pieces that are out there is people are taught to push on the sensitive spot. Find the sensitive spot and press on that, and then move the leg to release the psoas or stretch the psoas. Is every tender spot that potentially falls underneath or above the psoas, is there anything else that could be sensitive above it or anterior to it?
Sure. I mean, there's so many organs, and there's, a good 10 or 20 things that could happen to every single structure that I described earlier. So, there's plenty of other things that can be causing pain in that area. Perhaps if it really is a psoas issue, resting it would be the thing that would help it the best.
Okay. Because the ureters and some of the nerves lie right on top of it. As well
that's
as
true.
You said someone could have impacted bowels.
True.
And they could press on that, and that might be sensitive.
That's true.
So just because it hurts there when you're pressing on it doesn't mean it's the psoas.
That's right.
Because there is a lot of stuff in the way.
Right.
And so we need to be considerate of that. Do you think there are any benefits to pressing and working through that area?
I've heard that some people do, gain some benefit from it. I've never tried it myself, so I can't say that I can speak from experience. But I also don't want to deny that some people have had benefits from it. So I don't really know, truly, myself.
In your opinion, risk versus reward?
I kind of think it's not worth it because, again, if you had pain there's so many other things that it could be. I do think that the psoas is such a medial and posterior structure that would be so hard to reach it and to kind of get the type of treatment that you're going for. And again, there's so many other structures in the way that could, potentially be injured. It's not necessarily hugely likely, but there is the possibility. So I don't know that it's necessarily worth it.
Got it. So what would your recommendations be for somebody, they have tight hip flexors, they want to improve their range of motion, to work on that area?
Well, I mean, as an amateur athlete myself, I would say that probably stretching or resting would have more benefit than
Got it.
trying to mash on it.
Okay. And my recommendation, because I work with I'm a chiropractor myself and I do body work, and I know a lot of massage therapists work on the psoas as well. I think that maybe we can't directly get to it, but perhaps there is some sort of reflex in stimulating the nerve endings in the abdominal fascia and maybe some of the other structures in there that could give people benefit. I don't think, kind of like you, that we should just go in there and aggressively jam in there, because there are structures that maybe that's not the best thing for them. But I think with a trained hand and maybe a soft ball or someone's own hand, if they laid on their back and pressed through there, that might be a safe way to do it if you're going to do it. But I respect a lot of what you say, because you deal with this stuff every day in the operating room.
Oh, thanks.
Yeah. So thanks for tuning in and watching this video, you guys. Thanks again for spending some time with us and giving us your opinions.
All right.
I'll see you guys next time.